Active TV, seeing beyond. Active TV, seeing beyond. Active TV, seeing beyond.
Do you know the world is being ruled by the ideas and inventions of generational thinkers?
The Wright brothers invented the airplane. Thomas Edison invented the light bulb. Though they are dead and gone, their ideas and inventions are still benefiting mankind.
Our boarding house, so comfortable, a home away from home indeed.
We are the young inventors, and as generational thinkers, this is where our researches are conducted for inventions.
Ici, c'est notre bibliothèque où nous faisons nos recherches.
Do you want your child to be a generational thinker? I introduce you to
Pure City International School.
Day and boarding.
Admission is open from preschool to JHS.
Thank you for staying with us and joining us on this first edition of PM Express in 2021. And it's very important that we start on this note. One of the biggest things for parents going into the new year was whether or not schools will reopen. I am a parent, and it's been a major conversation at home, and everybody has been having it. Will the children go back to school? That conversation has ended now. We know the children will go back to school, and the dates have been announced. The president first started it. Today, there has been further meat on the bone of that announcement from the Ghana Education Service. And I know as a parent, this is the most important conversation for me, and that is why I reached out to the Ghana Education Service and asked if they can be part of the conversation, that you hopefully I'll ask a few questions as a parent and answer a few of yours also. And so join us on this quest. It's very important to look at this. Why is this important? It's because of the COVID factor. And many parents are apprehensive, rightly so. And so the GES will join us to help allay those fears possibly. So what are the dates, the reopening dates? And all parents must bear this in mind, because this is so key. For SHS, if your child is in SHS 3 and SHS 2, green and single track, keep this date here in mind. It's January 15, 2021. It's when they are reopening. So keep that date in mind. If your ward is in SHS 1 and SHS 2 gold track, keep March 10, 2021 in mind also, because then that, if you have a calendar, you want to, or you have a notepad, make a note of it, because that will be important, and then you can plan towards it. JHS 1 and JHS 3 will, January 18 is a key date also for them, when they would have to go back into the classroom. Now, KG1 and P6, I have a child in KG, which is very important, and January 18 to 2022. I have a lot of questions around the KG1. My son in this particular bracket. I'm sure many of you also will have same, especially those on the lower primary, because they difficult to sort of tell them to social distance, to wear face masks. It's going to be pretty difficult, I guess, for our teachers and education service. And so we want to understand how they want to intend to keep our children safe. We'll try and get to that. And hopefully tonight we'll be joined by the Director General of the Ghana Health Service too, because this is a two-pronged conversation. There's an education conversation, there's a health conversation. They are working together. The educational officials and health are working together to keep your children safe. And so both of them will be on to help us explain this. Now, what are the authorities doing? As you can see here, there's a lot of work that has already happened that will continue with the disinfection of all the schools. And we also know that the provision of Veronica buckets are key so that you can wash your hands, disinfect, very important. Sanitizers and tissue papers will all be provided. As you can see, a lot of it that the GES have already procured so that to keep your children safe. There are reusable, washable face masks that will be given to all the children so they can use during the period that they're in school. These key things are, as all the health officials around the world have said, are the primary most important way of reducing the spread of COVID-19. The GS is investing in that. There are a few conditions though. The schools are not available for outside activities because you don't want to bring anything from outside into the classrooms. The semester system for JHS, what is a semester system? I mean, we'll get the GS to explain this for us all. BEC will be in November 2021. No more double track system for SHS 1 and 3. This is a big point that we'll get explained shortly. WASSCE in September, October as well. Now, this is a calendar that the GS has put out today. Proposed date for WASSCE, if you are in 2001, that's a year, and then we'll look at September, October, and then for proposed date for BECs in November. All these dates you need to keep in mind because you need to supervise your child to study, I guess. 2022, July, August is the proposed date, and then 2023, May, June, it's if you are the WASSCE and the BEC corresponding dates are here. So these are, I guess, a key thing. The closure of the schools, we saw this. This is how far we've come, rather. Remember, March 16, 2020, closure of the schools by the president due to COVID-19. We've traveled a fair bit of the way, almost a year to the day, really. March is just, like a couple of months away when this happened. In June 15, gradual reopening of the schools started. Remember, there is some learning that I understand the GES possibly would have made when they reopened school for the final years to go and write exams. They would have learned a bit that they're probably going to use as a basis to, I guess, implement the next phase going forward. Then October 5, 2020, JHS2 and SHS2 students returned to school to complete the calendar. And it was very minimal incident when they did this. And I guess it's the lessons that they want to implement in this new era going forward. And so join me as we have this conversation. A lot of questions that you've sent already. I'll put to the GS director, who is my guest after this break, Professor Opoku Amankwah. We'll also thankfully be joined on Zoom by the Director General of the Ghana Health Service also. So stay with me on PM Express. And thank you very much for staying with us here on PM Express. And of course, a happy new year to all of you. We're starting the year, obviously, with the big question about the schools that are reopening. And I'm delighted to say that the Director General of the Ghana Education Service is in the studio with us. Professor Opoku Amankwah is my guest in the studio. We'll be joined shortly on Zoom by Dr. Patrick Kumar-Boadjeh, who, of course, is the Director General of the Ghana Health Service. They've been working together on this. Of course, a key stakeholder also is the teachers. And so we expect Nat to also share thoughts on this reopening going forward. Philip Lasig is the president of Nat, who will also join us in the course of the program. And the key thing, as I said, for me and my ward is in the private schools. And that this reopening is both private and public. We thought it will be important to have the private school represented in the conversation. So for those of you who have children in private schools, they can also answer a few questions for you. Dr. Damasus Turusun will join us, acting president of the Ghana National Association of Private Schools, will also join us later. We want to have a whole conversation. So as a parent, you could have the closure on all the questions that you have. Prof, thank you for joining us.
Thank you for having me.
And Happy New Year.
Same to you.
Great. So let's start by, I know you're also a parent. You are, right?
Yeah, it's but mine are to the tertiary.
Okay, great. Yeah. I mean, even there, of course, I know it's so part of the
issues.
Yes. Yeah. So for address the concerns of parents, for example, who will still say, COVID is still a thing. We've heard that it's spreading elsewhere. So why are you opening schools at this time?
Okay.
When a parent asks you that, what would you say to him?
Okay, good evening and thank you very much. Happy New Year.
Yeah.
Yeah. We have listened to the health officials, and from what they tell us, COVID has come to stay. And if indeed COVID has come to stay, and it's going to be part of us, then it means we also have to find ways of living with it. If we continue to decide that there's COVID, so we won't make any move, probably there wouldn't be life for us. So once we are able to accept the fact that this is the new normal, you have to find a way of living with the new normal. And the journey started, as you indicated, somewhere in March last year. At a point, we realized that there was the need for the final years to go and finish school. We put in some measures. They went to school and they were able to go through and finish. In there, we learned some lessons. Then we also realized that the next group of students who will possibly be writing exams very soon are those in SHS2 and then JHS2. And we also put in some measures to enable them to at least cover some of their lost times. And as you rightly indicated, through that, we learned a lot, but also we realized that it is doable. The president had said much earlier that we'll be going back to school in January. So from the lessons that we learned, and then from the health point of view and other considerations, we felt that there's a need for us to reopen school. Key to us is to ensure that we put in the relevant measures. Whilst we do that, we believe that everything will be smooth sailing. Yet, so parents should be assured, at least for those who went to school, the first group of students in June to September, and then those who went in October, we realized that there were measures that at least, because it was our first time, we had a few issues, but we were able to deal with that. Once we've seen the challenges that we have and we are ready to resolve them, we believe that we can.
Let's walk through some of the key measures you're rolling out to limit spread and protect the children.
We want to observe all the necessary COVID protocols. First, as the president announced, we're going to disinfect all the schools. The next thing is to ensure that everyone has face masks, both teachers and students, and all the staff who will be working with the students will have their face masks. We're going to provide them with the sanitizers. We're going to provide them with the Veronica buckets and washing soap, and then also the tissues. But key to these things are education, and we're going to continue to do the education throughout the period, and also monitor to ensure that whenever there's an issue, we know what to do and then we act on it effectively. Another thing that we have also done, actually we started that way back in 2017, where we started mapping out the SHS schools to the various health facilities that we have in the country, so that whenever they have an issue, they will know where to go. Then when the COVID came, we needed to improve on that, mapping out all the schools that we have, both SHS, JHS, and now going down to the primary and the KG, to map them out, and then have task forces in our schools who will be giving some basic knowledge about things to do, things to observe, and how to deal with some of these issues when they see the signs. Once we are able to do these things and do them well, we are very sure that we will reduce the challenges that we have with COVID.
Okay, so the mapping is where you map a school to a health facility.
And that is a job that we've been doing with the Ghana
Health Service. Okay.
Yeah,
we're joined by Dr. Kumar Badzee shortly. Now, one of the key concerns parents ahead of the show sent me was the concern around social distancing, which is a key, I guess, protection pillar. Okay. How are you going to maintain social distancing, for example, in our schools? It's a tricky one.
Yes, it is, especially when you talk about the KGs,
yes,
primary schools.
Yes, I have a 2-year-old child.
Yes.
And so my wife wanted me to ask you that question.
Yes.
How are you going to keep my son and the millions of others children like mine safe in the classroom?
I have a good friend who was telling me about her son when she told the son that she has COVID, and so the son should not come closer to it. Then the son said, "Mommy, I also want to have COVID." I also, you know,
it's fashionable for kids. I mean, father has it. It must be something good.
It's something that will be a bit challenging, but the health people tell us about the immunity of the children. That is something that we want to believe that it will work to our advantage. Again, we also believe that once we get them to use some of the basic things. For example, the younger children, we don't expect to be giving them bottles of sanitizers. You know, that may even go and cause some other challenge for us rather than. So in their case, we will encourage them more to be doing the hand washing with their teachers. What we want to be doing now is that we have a couple of NAPCO people in our schools. For those smaller groups where they have large classes and there's only one teacher taking care of them, we're working it out at district levels to ensure that we have at least an additional person as a teaching assistant helping the class teacher to maintain some level of social distance. I mean, but we believe that with these smaller things that we want to do, we should be able to do that. For them, their main way of learning is through play. So if you want them to go to school and you don't want them to be interacting, then what will be the need for that? But they have to still be in the school environment and still be interacting. Whilst at home, they're still doing the interactions and things like that. We're giving the teachers extra training on these things, working with the health people, so that we can, whenever there are signs of this nature, we'll know what to do. But we believe that looking at good practices elsewhere, we should be able to do that. And from what we've learned from the initial school reopening, we should be fine.
Something else that you did at that time when schools went back for the exams was, I remember the GS had a specific number of students for each class. I think it was 25, if I'm not mistaken.
Yeah.
For each class. Why don't you have the same so that you are more definite?
Yeah.
In the numbers in the classes? Because the teacher today called and said, in the school in which he teaches, in this class, there are 90 students, and it's already very small. How is he going to ensure social distancing? I mean, what's your reaction to that? Because you've done this before where you had numbers. So why don't you introduce the same principle?
Yeah, we introduced that principle when we had only one group of students, one cohort of students, or two cohorts of students at a time going to school. When you get all of them going to school at this time, you will do your social distancing, but it may not be as it is. So with interaction with health, what we've come up to is that once we are able to provide the basic things and also get the teachers to be more attentive to whatever is going on in the class, and then bring in this, teaching assistants and other things, we believe that we can do that. But in our conversations also with the unions, they also propose some ideas that why don't we explore the various facilities that we have in various communities. For example, almost every community, you have a number of churches in there. For some of them, they even have the main church, and then they have a smaller one where they use for children.
Children's service.
Children's service and things like that. So why don't we explore those things? There are areas where they have some youth centers and things like that. So this week, a lot of the work that we'll be doing with our district directors, with our regional directors, with CHAS, with COPS. COPS is the Conference of Heads of Basic Schools. We're meeting the executives, we're meeting the general managers of the mission schools and things like that. These are things that we've already given them some template so that they are giving us the exact numbers per every school, per every class, and then based on those, we also get them to go back and within every specific area, you get your own way of doing some of these social distancing to ensure that everything works right.
Okay. There's a solution that the government and the GS had implemented, double track.
Yeah.
The question is, don't you need double track now more than ever before?
We don't think so for now. We don't think so for now. We believe that once school reopens and we start these things, and it's not, I mean, the class that has 90 in a class, you also go to some places where you may have 50 or 40 or 10. Sometimes you have a whole class about 10 or 5 or so in the class. So it's not widespread, you know, and that is why I want to sit with the unions and the various associations and the various directors and things, and then work them out on specific basis and see how best we can do.
So double track would have been a big help. I mean, your timeline for phasing out double track, has it elapsed? It hasn't, right? I mean,
no, it hasn't.
Yeah. So that announcement.
But the double track, it's specifically for SHS, not
true. But still, for SHS2, I think they're also going to be double track.
Yeah.
But 1 and 3, no double track for them. Yeah. But that would have helped your cause, at least for that part of education. True. If you had that, would have limited the numbers in school for you. Do social distance.
At least at the SHS level, looking at the infrastructure development that has gone on now, we believe that we can do what we have proposed. That is first years single, and then final years single, and then the second years will do the double track for now. We believe that all things being equal, by the time we get to the end of the academic year and going into the next academic year, possibly would have phased out the double track in most of the schools. We started with about 390 schools, thereabout, and now we are now, for first year and third year, for these schools, all of them will be doing single track, whilst we do the double track for them. So with time, we could also take up some of the schools on that line. Yeah. Okay.
I want to bring in the other stakeholders into this conversation now. We have. I'm very curious about. I mean, the GES remit is mainly public schools, Prof.
Yeah.
But there are private schools that the President's directive, the opening affects as well. So I guess the key question is monitoring to see how they are implementing. Also, thankfully, we have the acting president of the Ghana National Association of Private Schools also joining us via Zoom right now, Dr. Damasus. Hello, Doc. Thank you for your time here on PM Express. Hello, Doc. We also have joining us tonight is Thomas Musa. He's the General Secretary of the Ghana National Association of Teachers. Hello, Thomas. Hello, Thomas.
Hello, good evening to you and your viewers.
Good evening. How are you doing?
By God's grace, I'm doing well. Wishing you a happy new year and all your viewers, and particularly teachers.
Absolutely. I wish you the same. And the GS director is here. I must say, I think I might have met both of you at Asempa today.
Exactly.
Okay. Well, so this is a continuation of that conversation. So tell me, what is the teachers, the teacher unions? What's your own input in this decision to reopen? Good one?
Yes, please. I think we've met the management of the Ghana Education Service. We've discussed these issues. But before we come to the issues on the table regarding what the president said and matters arising, it is very, very important for us to appreciate where we are now and what has brought us here. Is very, very important. Number one, We are here as a result of COVID and the resultant effect of the closure of schools as far back as March last year. Now, what has happened is this. If you take our population, taking into consideration the Ghana Living Standard Survey, if you look at the population, we are told we have a little over 31 million. And those children between 0 to 4 years, they constitute 6.3%, approximately 2 million. And if you take that same population and you do analysis of it carefully, you realize that, and also taking into consideration 3% error margin, you realize that the children that are within the population who are 4 years old, they are 651,000. 651,000 who are ready to go to KG. And so if we do not do anything about it now for them to go to school, what is going to happen is that instead of going to school at age 4, we have children going to school at age 5 and 6. And learning of concept is better done at earlier stage of like age 4, as has been our educational age of going to school, than anything. So going to school in January is one of the things that we think that it has come at the right time and everything must be done. Number 2, we are also confronted with the issues of child labor. In fact, if you look at the Ghana Living Standard Survey, same thing, that's different than the round 6. We are told that that one was published as far back as 2014, 2015, thereabouts. And we are told that out of 5 children you see, you have 1 is into child labor. Okay, and at that particular population now we're giving, we are talking about 21.8% of the children were into child labor. And that is also disturbing. And in fact, we've really done some work to get make some gains there. But as a result of the COVID, the gains that were made, the gains have been eroded. And another difficulty that has arisen has to do with the teenage pregnancy. Look, in one of the districts, some work that has been done in one of the districts between March to May 2020, we have 51 girls pregnant. 51 girls pregnant.
So I guess the point you're making, the bigger point you're making is that COVID and the continuous closure of schools has increased teenage pregnancy in some of the areas. Exactly.
And the last thing I want to add here, see, the more the children staying in the house, already what the children were taught, they are forgotten. So we have some kind of deficit of learning already to cover. And so the more they stay in the house, it means that, so for example, a child who is in class 2, who was taught at least the first and second, was taught the first and second term. It's left the third term to complete. Now we have lost the third term. We have lost the first term. And so by the time the child goes back to school, the teachers will have certain amount of work to do to enable them to recover the things that they have forgotten and all that. So coming from there, the announcement of the president to ask the children to go to school, it is something that we share into it, having discussed the whole issue of the Ghana Education Service. And we believe that this thing will take 4 levels, because we know there are people who are having 1 or 2 challenges, but they need to appreciate that it will happen in 4 levels. The level 1 is what the president has done. The level 2 is where the minister will give guidelines and other detailed, rules of engagement regarding the times we found ourselves. We all know that we are not in normal times. We are in abnormal times. And in abnormal times, within the next 2 years, we have said that between now, 2021 to 2022, the kind of measures that we will need to adopt so that we can get out of this and come back to our normal life, which is not something that can make all of us comfortable. But hey, we need to get it done for our own country, Ghana.
So let me ask.
And the last one will be getting the Ghana Education Service, the guidelines, to get out the needed resources for them to deploy, to deploy this kind of resources together with the guidelines at the various teaching and learning institutions so that they can supervise and we get it done.
Let me ask you, there's a fundamental question that the Director General had addressed, which is the social distancing, but also the sheer number of children that you have in the public schools. I went to Saito. So that's another way of saying a public school. Proud of it. I mean, we know the numbers that sit in the classrooms. The question that I asked him earlier, I need to ask you because you are the teacher. How do you deal with that challenge? Because we know the typical numbers in our public schools. As a teacher, the GS director had explained what conversations are still happening to try and reduce the numbers and share that in some other available infrastructure, etc. But for you, the teachers, how do you deal with that challenge of the numbers? And we know COVID, is limited in spread when you socially distance.
Before I proceed, let me salute my Director General. I salute you, DG, and together with the other panel members. I salute you, sir.
Yeah.
So back to the substantive issue regarding how to manage the numbers.
The numbers.
Yeah, we discussed it. We discussed the issue, and in fact, we agreed that it will be very difficult for us to manage it at the top. Because you see, we cannot be in all the districts to indicate exactly what must be done. So take, for example, if you take a particular district where they have a children of 150, that particular district, they could have some churches, mosques, and all those things. Okay, in another district also, they might not have such facilities. So what must be done? And so the discussions we are having is that certain amount of discretionary powers will have to be given to the district directors and the regional directors. Now look, in your own district, if there is a situation like this, we can only give you some kind of guidelines, but you as the manager at the center, you should be able to exercise certain amount of discretion to know how you can manage a situation and ensure that teaching and learning takes place. Because we have already said that we cannot, those of us at the top, like the Director General who is here, who is in the studios now, he cannot provide all the solutions at the district and regional level. That cannot be. So the district directors and the regional directors also need to come in, because after all, they all work towards the Director General. So the issues there, they have to engage the teachers very well, have that kind of conversation. How do we get teaching and learning going? At the same time, ensuring that each and everyone is safe and secure in a teaching and learning environment. So it will be difficult, if not impossible, to give exact prescription as to what should happen in all the districts and the regions. So because of that, certain amount, like I've said, certain amount of discretionary powers will have to be given to them for them to exercise at the regions and the districts under the supervision of the Ghana Education Service.
Okay, you raised a very important point about guidelines. Prof, let me bring you in here. So I think he's explained, I think you also touched on about the discretion. So you're looking at your peculiar situation and then making the decisions as to how do you implement the policies to ensure you protect the children. So it comes back to the point, the word you use, guideline.
Yeah.
So what are the general guidelines within which a district education director who looks at the numbers, what broad framework is it going to work in? So, for example, are you giving them guidelines as to the ideal size for an effective class that limits spread, for example, so that they can work within and say, then if I have space, then I'm going to distribute these students in these other, available spaces so that I achieve your guideline? Are they been giving these guidelines, and what are they?
Yeah, as I indicated, we expect to be meeting during the week.
Okay.
To talk about some of these guidelines. But the key guideline comes from the health people who give us an idea as to how to do your social distancing and things like that. So once we get that broad guidelines, we don't want to pin people down to some specific. For example, you can have a class of 30. Do you need to social distance them into 2 classes, or you need to just put them in there as just a class, but with some considerable space amongst them? So we don't want to be giving strict. The moment you give some strict guidelines on some of these things, it will defeat the opportunity for them to be innovative. Remember that all district directors are part of the district assembly. And as part of their meetings and interactions, they are supposed to work with the district assemblies to find solutions to these challenges that are in their schools. the basic things will be provided, the basic guidelines will be provided, but when you go in there, you are working with the district assemblies, you are working with the communities, the churches, the chiefs, heads of communities, the faith-based organizations, etc., etc. You know your peculiar situation. So working within the broad guidelines, you ensure that these things, and then once you do that, you document them, and then you can always give us a reason for doing A or B. And if there is also some additional guideline that we need to give, your regional directors are there, the district directors are there, the school heads, and then it cascades down there to ensure that the right things are done.
Okay.
But we believe it's, once it has to do with health, we strongly believe that all of us, we are all generally cautious about it. We have some apprehensions about it. So we strongly believe a lot of the things that we will put in place will be things that we will all want to put in place and allow them to work to our general benefits.
Okay. Yeah. Well, one of the key things that we'll talk about soon, it's how do you recover the lost time? Yes. And for children who have lagged behind. I mean, for parents in private schools, we know what it has been. I mean, investing in internet and etc. Yeah. But for the public schools, I can't imagine the site I went in. There will be, any parent can afford data. My mother could definitely not afford data. So the question is, how do you bridge that gap, that lost time? We'll come to that shortly. But I want to bring in the private school representatives, and because they are key for many parents, their children would have gone to private schools, and so it's important to see how they will be implementing these directives. And thankfully, we have the acting president joining us right now on this very important part of the conversation. Thank you, sir, for your time here on PM Express, Dr. Damasos. Hello, Doc. Hello, Doc. Can you hear me?
Hello.
Yes. Thank you very much.
The pleasure is mine.
Great.
I'm glad to be on your program.
Great to have you. So tell me, the private schools, you heard the president's announcement. The GS today had broken it down further. How are the private schools implementing this, the reopening? Are you reopening? Are all private schools reopening, or what's the approach?
Most definitely. We have no option but to go along with the president's directive. Indeed, if we had our way, this would have happened way back in September last year, because we had advocated very strongly for a reopening in September last year. We have waited very eagerly for this moment to bring back the Ghanaian child to school and do what we love doing best, tutoring young brains and bringing them up become human resource for Ghana. Many of the protocols, abiding by the protocols, will not be as difficult for us as the public schools I can envisage. For instance, one of the major hurdles they have to climb will be how do they ensure social distancing in classrooms and all of that. The main attraction of most private schools is our smaller class sizes. If you are a private school who clutters your classrooms with children, you are unlikely to attract many parents to bring their children to your
That is so right. I mean, every parent will look at how many children do you have in each class and how many teachers you have for them. I know that's what I would do as a basis for making the decision with private school to go.
Yes, so the social distancing ought not to be much of a problem with that. Fortunately, we do get some assistance from government in terms of fumigating our environment and provision of some PPEs for us as well. So I guess we are pretty ready for the recall back to school. But of course, we have challenges that the government schools will also be encountering. For the past 10 months, we have been down and out. Some operating at about 20% capacity in terms of the private schools. So bringing our facilities back to speed becomes a challenge for us. Infrastructure that's gone, eaten away by cobwebs and termites will have to be renovated and painted. Furniture that is broken and discarded will have to be replaced. Teachers who have left the classrooms by now after not being paid for so long, we need to begin recruiting teachers all over again and basically putting back our facilities into shape to receive children back in the school is going to be a very difficult task for us. We wish the announcement had come a little earlier to allow us to prepare adequately for them. Giving us a week and a half to get ourselves ready is obviously not sufficient notification for us. 1 month notice perhaps would have assisted us a lot to get ourselves back in shape. But all in all, we are working very hard indeed to be ready when 15th of this month comes along.
Yeah, I mean, one of the key things as a parent in the private school I'm interested in is supervision by the authorities, because private schools, as you said, you've had a period of lean with a lot of difficult moments with both the teachers, schools closure, etc. There's a tendency sometimes of some private schools to cut corners now that the schools are reopened, so to make money back quickly, pack the rooms, etc. And also the enforcement of the COVID protocols will cost money because you have to buy Veronica buckets, you have to get some sanitizers. That was the extra cost that you didn't used to bear. Within the circumstance under which you've already have run very lean, first the association. What measures are you putting in place now to ensure that the private schools that reopen don't cut corners because COVID protocols might cost extra money?
Yes, the message we have begun sending across all our members is this. You see, it is not in our interest to have government reopen and shut down again owing to escalation of the virus. Mm-hmm. Therefore, it is in our interest, much more than even the public schools, to have the COVID under control, under wraps, so that schools will continue to operate normally. So we keep cautioning each other. I mean, there's no way we can compel everyone to abide by all these protocols, but we keep cautioning each other that we need to be very cautious, ensure that the right things are done in order to contain the virus. But of course, we also bear in mind the fact that there are regulatory bodies. Right now, NASIA, National Schools Inspectorate Authority, is our supervising authority, and we are aware that they have registered some of our schools, and they have a way of tracking, going around to inspect, to ensure adherence to many of these protocols. So it's something we are not taking lightly at all.
Prof, what assistance is government giving the private schools?
All the private schools will be fumigated or disinfected. The disinfection program covers them. They all get Veronica buckets, tissue papers, thermometer guns, sanitizers, and all those PPEs, the face masks that the government provides.
All private schools?
All private schools.
Why? Why are private schools getting public taxpayers' money for face masks? It's a devil's advocate question, but I have to ask
it has to do with health and what the implications of the COVID. Once a person is affected, the COVID doesn't know whether you are a private school student or you're a private school teacher or whatever. And then if you have it and you're spreading it, you could be spreading it to any other person. The health implications, I said that you have to go beyond that and then support it, irrespective of how much it will cost. So the government feels that If we don't do that, and anything happens, I mean, the consequences may be more expensive than doing that. So
they get Veronica Bucket face masks.
Face masks. All the protocol, the PPEs that we are providing, the schools will be sprayed. You'll get the Veronica buckets and what I call the washing facilities, the Veronica bucket, the soaps, the tissue papers, and then they get the face masks, the thermometer guns that we provide. We do that for the schools as well.
That's a logistical nightmare, because the public schools alone, they are a lot. And then you have private schools also. That is one big logistical nightmare.
But we need to do that for the sake of good health for the country. We necessarily need to do that. Yeah.
Well, I want to take a quick break. When I return, I'll talk about supervision. Once you've given it to them, now you have to make sure that they actually using them the way, and then also making up for the lost time. Stay with me when we return. If you're a parent, we'll ask that question for you when we return. And thank you very much for staying with us here on PM Express. It was a very good conversation, and I'm enjoying asking it on your behalf as a parent as well. Very important conversation to be had. Doc, so before the break, we're talking about the government support for the private schools. In all, how many school children are you planning to assist with this in this COVID protocol that you are rolling out for the education service?
Yeah, for both private and public schools, we're looking at a total of about 9.2 million
students and
their teachers, who have to be catered for under this new reopening, which goes for all schools. That is the number that we are looking at.
That's a huge number.
So almost 10. I mean, if you run it up, we're looking at something around 10 million people. Yeah.
Okay. I mean, I was just asking the question for the private schools who charge us a lot of money.
Yeah.
Lots of money. Some even charge us in dollars. You're going to give them all this for free, but we are not going to see a corresponding discount for parents who are going to be struggling.
Well, that will be some negotiation that you need to have with them. But the basic things, government wants to ensure that we have them. We don't want to have any excuse for the spread of the COVID. And once it goes, as I indicated, once it happens in any group of people,
implications for everybody.
There is implication for everybody. So once we're doing that, I believe that it's something that we should be grateful that government is willing to do that. At least it gives a sense that our resources are going in for something that we all...
Do we know how much roughly this is going to cost us? I mean, the 10 million or 10 million?
10 million.
10 million individuals. Do you know roughly how much this is going to cost us?
Not really. I can't. The finance people will give us the detail, but we give them the numbers, and then based on the things that we need and then the pricing that they do, then we get the idea of that.
What about supervision, especially of the private schools, to ensure that once you've given them all, that they're actually using it the way they should, and they're keeping the children
in
safe?
The previous two reopenings, the part of the training that we did and part of the monitoring and supervision that we did also covered the basic, the private schools. And we're still going to go along with that and then do that. In fact, the various committees that the president has put in place to work to ensure that this reopening goes through, we have representatives of private schools on those committees. So we work together with them and ensure that everything works well.
What happens to a private school you find in your monitoring that is breaching these protocols?
Whether private or public, once you breach the protocols, we will ensure that the right sanctions are applied. In fact, we have...
How severe are these?
We have heard, and I hope it is not true, that we've heard that some private schools are have indicated that they will want to test their pupils before they come to school. And probably, once we talk about tests, probably the parents are going to bear that cost. But as far as testing is concerned, I believe that those directives are directives that should be coming from the health officials. Once the health officials have indicated that it should not be a condition for going to school, we expect that they will not go that way. We expect that they will not go that way. It's something that we should all take it key. From the president of the private schools, from what he said, they stand to benefit more even than the public schools. So I believe that they will abide by the various rules and regulations that will be put in place, the protocols, health and safety. This has to do with our health, and it is important that we abide by the...
You raise a very important point, and so if you're watching us and you're a parent, the Director General says if you are a private school, says pay for your child to be tested before their child comes back to school. It's not part of the government directive. The government says they've consulted broadly with stakeholders, the health officials, and they haven't made testing a condition for returning to school, correct?
Yes.
And so if a school is doing that, can you report them?
Yes. If a school, if you're a parent and the school says you should do that, please let us know, and then we will apply the right sanctions.
What about parents themselves who might say, well, some parents can actually be that insistent that the school should test everybody. I don't want to bring my child into the school when I don't know your status, the status of the child who is sitting with him, and my demand that, some parents can actually make that demand.
Well, you can decide to test your son or your daughter or your ward before you take him to school, but you can't compel the school to test all the students in there before you take your child to the school. I don't think that will be good enough to do.
Okay.
Yeah.
And let's talk briefly about how are we recovering the lost time.
All right.
So this is how many months or how many hours have you lost so far?
In our analysis, what we did was that we took the group that will be writing exams, the nearest exams, or the group that has, who are going to the final year now. And we use them for our analysis because we know that for the others, we can always make up for the lost time as they move on. Now, for that group, we realize that they have about 1,701 hours to cover before they go into any exams that they have to be writing. So we looked at various scenarios. For example, we know that we write our exams in May, June, before the COVID. So assuming that we want them to be writing the exams in May, June, would they have covered the 1,700 contact hours that they need? From our analysis, they would have covered 980 contact hours, and they will be left with 721 contact hours. So they wouldn't be well prepared to write exams in May, June. Last year, because of the COVID, we had to write the exams in August, September. So assuming that we decide that we want to maintain the August, September, would they have covered the 1,701 contact hours before writing that exams? Per our calculation, they would have covered 1,520 hours. And they will be left with 181 hours to the exam. We also know that the WAEC they have their May, June exams, and then they have their October, November, December exam, the NOVDEC that we know about. So assuming that we get them to write the exams in November, NOVDEC, would they have covered the 1,701? Yes, they would have covered 1,880 hours, which will give us 180 more hours. But the challenge then will be that when the exams is written around that time, there will not be enough time to do the marking for schools to reopen the next January. So we went back and then went to September, October, and realized that if we use September, October, we would have covered 1,700 contact hours.
Okay, so that informed
we'll be left with just one hour contact hours. Then we are assuming that the COVID will stay with us for a while. So how do we work to ensure that we get back to normalcy? And from our arrangements, we hope that next year, 2022, we should be able to write the exam somewhere in July, August for WASSCE, and then September for the BEC. And then by 2023, we should be able to come back to our May, June, the normal.
That's when things normalizes. Okay.
So these are the things that we did to.
So it's a long-term plan to recover.
Yeah.
Thank you, Prof, and thank you to the NAT secretary who joined us. Obviously, Mr. Musa, I'm grateful that you joined us, and Dr. Damasus as well. Enjoy the rest of it.
Do you know the world is being ruled by the ideas and inventions of generational thinkers?
The Wright brothers invented the airplane. Thomas Edison invented the light bulb. Though they are dead and gone, their ideas and inventions are still benefiting mankind.
Our boarding house, so comfortable, a home away from home indeed.
We are the young inventors, and as generational thinkers, this is where our researches are conducted for inventions.
Ici, c'est notre bibliothèque où nous faisons nos recherches.
Do you want your child to be a generational thinker? I introduce you to
Pure City International School.
Day and boarding.
Admission is open from preschool to JHS.
Active TV, seeing beyond. Active TV, seeing beyond.
Do you know the world is being ruled by the ideas and inventions of generational thinkers?
The Wright brothers invented the airplane. Thomas Edison invented the light bulb. Though they are dead and gone, their ideas and inventions are still benefiting mankind.
Our boarding house, so comfortable, a home away from home indeed.
We are the young inventors, and as generational thinkers, this is where our researches are conducted for inventions.
Ici, c'est notre bibliothèque où nous faisons nos recherches.
Do you want your child to be a generational thinker? I introduce you to
Pure City International School.
Day and boarding.
Admission is open from preschool to JHS.
Do you know the world is being ruled by the ideas and inventions of generational thinkers?
The Wright brothers invented the airplane. Thomas Edison invented the light bulb. Though they are dead and gone, their ideas and inventions are still benefiting mankind.
Our boarding house, so comfortable, a home away from home indeed.
We are the young inventors, and as generational thinkers, this is where our researches are conducted for inventions.
Ici, c'est notre bibliothèque où nous faisons nos recherches.
Do you want your child to be a generational thinker? I introduce you to
Pure City International School.
Day and boarding.
Admission is open from preschool to JHS.
Active TV, seeing beyond. Active TV, seeing beyond.